When you go for regular checkups at your hospital, one routine part of their checkup is placing a small device that looks like this on your finger or toe. But what is this device? This device is called a pulse oximeter. But what does it do? A pulse oximeter monitors the amount of oxygen you carry in your body. But how can an oximeter measure your oxygen levels? A pulse oximeter has two components to its device: a light source that emits light, and a photodetector, the part that receives the light when turned on. The light source passes through the finger placed in between the oximeter. Some of this light gets absorbed by the finger, while the rest reaches the photodetector. The light source emits two different wavelengths of light. These lights affect blood with oxygen and blood without oxygen differently. This allows the device to measure the amount of oxygen in the blood. Now, how do you read a pulse oximeter? An oximeter displays two different numbers. One of these numbers shows the SpO2 concentration of the blood. But what is the SpO2 concentration? The SpO2 concentration is the percentage of the amount of oxygen your body carries compared to the maximum amount of oxygen your body can carry. The ideal amount of SpO2 concentration you want showing on your oximeter is 95% to 100%. If the reading shows below 95%, that is considered having a low amount of oxygen. The second number is your pulse rate, which is the amount of time your heart beats in 1 minute. Children can have different pulse rates based on their age. For newborns till the age of 11 months, the average pulse rate is 70 to 190 beats per minute. For kids ages 1 to 2, the average pulse rate is 80 to 130 beats per minute. For kids ages 3 to 4, it's 80 to 120 beats per minute, and for children ages 5 to 6, it's 75 to 115 beats per minute. For children ages 7 to 9, it's 70 to 110 beats per minute. And finally, for kids above the age of 10, it's 60 to 100 beats per minute. Even though the pulse oximeter can determine the amount of oxygen in your blood accurately and your pulse rate, there are still some factors that can affect the amount of accuracy of your numbers. Tobacco use, skin thickness, temperature, as well as pigmentation, nail polish, and pore circulation can affect the readings that appear on the pulse oximeter. Next time you go to the doctor's, try reading your oxygen saturation and pulse rate when you have the pulse oximeter on.